This segment of DelmarvaLife is brought to you by TidalHealth.
Flu season is here, and it may be a very bad one. Now, there are several factors affecting the season.
But what you need to know is how to prevent getting the flu, right? Well, here to help with that very topic is Dr. Chris Snyder, the Chief Quality Officer with TidalHealth. Good to see you, sir.
Good to see you.
Good to see you healthy, sir.
It's a good thing.
So, Lisa, on occasion, we are willing to go out on a limb and take a real risk and make a statement like we're guessing the best way to prevent the flu is to get vaccinated.
Yeah, pretty simple.
Yeah.
Really is. So healthcare, we all get vaccinated. The whole hospital, it's part of our mandatory employment there. So, yeah, it's really important to get it, especially September, October. So we've moved past that. People always say, how long to get vaccinated? Probably up till February or March is okay. So the flu season can last into the summer, actually. So there's a higher risk population over 65 that you want to focus on getting a more potent vaccine, but it's all age related too. So kids 6 months and up, get vaccinated.
There you go.
Now, there was an article we read this morning saying that hospitalization rates for the flu haven't been this high this early since the 2009 swine flu.
Sure, yeah, we're seeing a flux of it. It comes and goes. So, and again, I think a lot of it is just we're more aware of viruses right now because of that little guy COVID. So, and it does make a difference. People were masking for the last couple of years pretty significantly, still are a lot of people. So I think a lot of folks didn't get the exposure.
Right.
So it may have impacted that, and RSV is the other one too that we're seeing a little more of right now. So, but again, there's a level of people didn't notice before, now they notice viruses. So.
Do you think that more people are getting tested for the flu than before?
Absolutely, I was just going to say that too, you read my mind. So we have a trivalent test where we test for RSV, flu, and COVID when folks come through the system, and so yes. So if we're looking for respiratory illness, we give them the triple whammy and one of the three show up. So whether they're getting significantly ill from the virus is a whole different perspective. So we do see a lot of like heart failure diabetics coming in the hospital with heart failure and complications of diabetes, and they may have a positive flu. Doesn't mean flu is active, but they've had an exposure and we're testing for it. So it's in the nares.
Okay. So other than masking and then not masking, are there other things that make the flu season worse?
Yeah. People don't wash their hands. So it's a virus, just like everything else. I mean, hand hygiene is huge. So use those alcohols, swabs, those things work great. So just, foam in, foam out whenever you go in and out of the house. Get used to washing your hands more. Exposure is key, especially as, Thanksgiving next week. We got a lot of people coming in the house. Everybody should try to do the best they can washing their hands.
We've got those things in the hallway here. I need to make more of a habit of hitting them when I walk by.
Hitting them up. And you had mentioned that age is a risk factor.
It is, yeah. Young and old definitely affects people with chronic illness, lung problems, diabetes. So taking care of yourself is key, making sure you're exercising, eating right, not using those bad habits, alcohol, smoking, those things all precipitate high risk for any virus.
If you're sick, stay at home.
Yeah, stay at home. We don't want you out. So
we don't want you.
No, and again, I just presented some data at the hospital today. I mean, keeping folks at home is a safer environment for the community, much as we learned with COVID. So, and COVID's really dwindled. It's under control, probably because of vaccination too.
Okay, Dr. Chris Snyder, TidalHealth.